All right, welcome back, everyone. We've had a ton of requests to really dig into microdosing psychedelics. I get it. It's definitely got my attention, too. Lots of buzz about the potential benefits. But, the research itself, it kind of feels like a hazy trip sometimes.
Yeah, you're right on the money there. Tons of anecdotal stuff flying around, but rigorous scientific evidence. That's where things get a little fuzzier.
Definitely. And that's exactly why we're here, right? We've
Yeah.
got a whole stack of research papers, clinical trials, even some notes from a lecture at Stanford. We're going to really get into it. So what's the goal of this deep dive?
Well, the big question, of course, is does it actually work? Like, does microdosing actually do what people say it does? And to get at that, we really need to understand what's happening at, the receptor level, you know?
Right.
Can these, tiny doses of psychedelics really be influencing our brains and our mood without sending us on a full-blown trip?
Okay, so let's talk receptors then.
Yeah.
I know that psychedelics work on serotonin receptors in the brain, but can you break down exactly what that means? Like, what's going on at that microscopic level?
Okay, so think of it like this. Our brains are constantly buzzing with these chemical messengers called neurotransmitters. They're basically transmitting signals between neurons. Serotonin is one of these messengers. It's super important for regulating mood, perception, sleep, appetite even.
Right, okay, so how do psychedelics actually fit into all of that?
So psychedelics like LSD and psilocybin, they bind to these serotonin receptors. Specifically, there's a subtype called the 5-HT2A receptor that's really important here. And when they bind, it sets off a whole cascade of effects downstream. It's what ultimately changes our perception and our consciousness.
So a regular dose would fully activate these receptors, right? That's what leads to those intense, mind-bending experiences that people usually think of when they hear psychedelics, right?
Exactly. But with microdosing, the idea is to take such a small amount that you don't actually hit that threshold. You're not fully activating those receptors. So it's like you're just nudging them just a little. It's possible you're still influencing those pathways, but without triggering the full psychedelic effect.
So a little nudge instead of a full-on push, basically.
So are there studies that actually show this happening? Is there any evidence that microdosing is really changing these signaling pathways in the brain in a way that matters?
Yeah, there's some really interesting findings out there, but the research is still pretty early. For example, there's a study from 2018 by Geiger and his team where they looked at psilocybin and how it affects the brain.
Right.
And what they found suggests that even small doses of psilocybin can influence brain activity, specifically in the areas that are linked to mood and cognition. That's fascinating. I was actually reading about another study by Nichols, I think it was back in 2016, and they found that psilocybin could actually improve people's moods and even make them less likely to recognize negative facial expressions. Do you think that's connected to this whole subthreshold receptor activation thing we're talking about?
Yeah, it definitely could be. What's really interesting is that when they blocked the 5-HT2A receptor, that specific one we were talking about, with a drug called ketanserin, those positive mood effects vanished.
Oh, wow.
So that suggests that that receptor is essential, at least for some of the effects of psilocybin, even at low doses.
So it's like blocking that receptor hits the pause button on psilocybin's ability to boost your mood or something.
Yeah.
Definitely seems to show that that receptor is important.
Yeah, exactly. And we're seeing, similar results with LSD. You mentioned those notes from the Stanford lecture. They were talking about how research has shown that the effects of LSD on how the brain is connected can actually be totally blocked by ketanserin, too. Again, it just reinforces the idea that the 5-HT2A receptor is a key player in how psychedelics work in general. Maybe even at these really low microdose levels.
So we're seeing consistent results across different psychedelics then. That's really interesting. You know what I think is super fascinating is this idea that our individual brain structures might actually influence how we respond to these substances.
Oh, yeah. It's like personalized medicine for psychedelics.
Yeah.
It came up in that Stanford lecture, too. They mentioned some research that suggests that the way someone's brain is naturally wired could actually affect how strongly they feel the effects of LSD.
Yeah, that's kind of mind-blowing, right? So are we saying that someday we could actually tailor psychedelic therapies to people based on their own unique brain structure?
It's a really cool possibility, although we're still in the early stages of figuring out exactly how that would work. But it really highlights just how complex the brain is and how it interacts with these substances.
Okay, so we've talked about psilocybin, we've talked about LSD, what about MDMA? There's been a lot of talk about its potential in treating things like PTSD. Is that at all relevant to what we're talking about here?
Well, MDMA is interesting. It's a little different. It actually affects serotonin like we've been discussing, but it also affects norepinephrine and dopamine. It's like a triple reuptake inhibitor, so it increases the levels of all three of these neurotransmitters.
Right.
It's important to remember, though, that the research we're seeing with MDMA for PTSD, those are using full therapeutic doses, not microdoses.
Right. Yeah, that's an important distinction. And I imagine like set and setting is probably super crucial in those therapeutic settings, especially when you're talking about something as powerful as MDMA, right?
Oh, absolutely.
Yeah.
There's this study from 2024 by Borkel and their team,
Right.
and they really highlighted how important that mental and physical environment is, along with like the person's intentions. It can really impact the whole experience. It's not just about the drug, it's about the entire context.
Right, right. Yeah, that makes a lot of sense. Okay, so we've talked about how these different psychedelics actually work at, like, the receptor level. But what about the big question? Does microdosing actually work? Like, all these people talking about increased creativity, better focus, better mood. Is there any evidence to back that up?
Well, that's where the science gets a little bit tricky. Truth is, research that's specifically focused on microdosing, it's pretty limited. Makes it hard to draw any firm conclusions.
So we've got all these people claiming these benefits, but not enough solid research to actually know for sure. Sounds like a classic case of the hype getting ahead of the science.
Yeah, it does kind of seem that way. I mean, there have been some small studies looking into like the cognitive effects and the emotional effects of microdosing, but a lot of them just have these methodological issues.
Okay, so like problems with how this study was designed, or maybe too few people in the study, no control group, that kind of thing.
Exactly. Yeah. And when you've got those limitations, it's really tough to tell for sure what's a real effect and what's just like a placebo effect or just random chance.
Okay, so the jury's still out on the benefits then. What about the risks? Are we talking like serious danger territory here or more like mild, temporary side effects?
Even when we're talking about microdosing, we still need to remember that we're dealing with, these are potent substances. They can have a real impact on our bodies and our minds. It just wouldn't be responsible to totally dismiss the potential risks, right?
Yeah, that's fair. Are there any, like, the specific risks with microdosing that we should be aware of?
Well, if you look at the MDMA data, for example, from that cruise study in 2020, they found, even in really controlled clinical settings, with full therapeutic doses, of course, they still saw some cardiovascular effects, things like increased heart rate and blood pressure.
Huh. That's a little concerning. I mean, MDMA is known to be, like, a stimulant, right?
Yeah.
So I guess it makes sense that even small doses could potentially put some stress on your heart and your circulatory system. Are there any other, like, potential risks that we should know about?
Well, from a psychological standpoint, while it's less likely with microdoses, there's always the chance that using psychedelics could trigger anxiety, paranoia even, or it could even make existing mental health conditions worse, especially in people who are already vulnerable.
Right. Yeah, and even with a small dose, I imagine if you're not getting the proper guidance and support, those experiences could be really tough to navigate. It's not like these substances magically become risk-free just because you're taking a tiny amount.
Exactly, yeah. And then there's also, the big question mark,
Yeah.
the long-term consequences. We just don't have any long-term studies on microdosing yet. So it's impossible to say for sure what the effects might be down the line.
It sounds like we're still really early in our understanding of both the potential benefits and the risks of microdosing, huh?
We are. And, that's why I think caution is so important here. It's easy to get caught up in the excitement and all the anecdotal reports, but we really need to stick to the science, especially when we're talking about our health and well-being.
Right. So where does this leave us then? What would you say to someone who's thinking about trying microdosing, given what we know so far?
I think the most important thing is just be informed. Weigh the potential benefits against the potential risks. And really importantly, talk to a doctor. Don't just rely on, stories you hear or stuff you find online.
Right. Definitely not a Dr. Google situation.
Exactly. Yeah. And even if someone does decide to try microdosing, it's just so important to do it responsibly. Start small, pay really close attention to how you're feeling, and definitely avoid mixing it with other drugs or medications without talking to a doctor first.
So proceed with caution, get informed, and talk to a healthcare professional.
Got it. Anything else you think our listeners should keep in mind while they're exploring this topic? Yeah. Remember, this is a field that's constantly changing. New research is coming out all the time. So stay curious, stay informed, and most importantly, stay critical,
Stay critical. I like that. It's so easy to just kind of get swept up in trends. But it's important to remember, like we said, these are powerful substances. They can have real effects, both good and bad.
Exactly. And it's not just about personal responsibility either. There's like bigger societal and ethical questions that we need to be thinking about too.
Yeah, societal and ethical implications, huh? That's a really interesting point. It really does feel like we're like right on the edge of a huge shift in how we think about psychedelics. And microdosing is kind of leading the way, right?
It is. And as more and more people are getting interested in this, we really do need to be having those bigger conversations, about the potential impact on society as a whole.
Totally. So what are some of those bigger implications that we should be thinking about?
Well, let's say microdosing really does turn out to be effective, even if it's just for specific things. How does that change the way we understand mental health and well-being? Like,
Mhm.
will we start to see psychedelics as tools to help us think better or improve our mood, instead of just thinking of them as drugs for recreation or spiritual experiences?
Right. We could be talking about like a total reframing of how our culture understands these substances,
Yeah.
especially when you consider how much stigma and prohibition they faced in the past.
Exactly. And then there's the question of access and equity, too. If microdosing becomes this really popular thing, will everyone be able to benefit from it? Or will it just be another thing that's only available to people who can afford it?
Yeah, that's a really important point. We've seen that happen with other health and wellness trends, haven't we? Where access often comes down to like how much money you have.
Right, it's a valid concern. And then you've got all the legal and regulatory questions, too. Like, how do we handle decriminalization? How do we regulate these substances? And how do we make sure people are using them responsibly, especially as they become more and more mainstream?
It sounds like a huge, complicated task. There's so many different things to consider. Individual health, societal norms, the legal system. It's almost, I don't know, it feels kind of overwhelming, to be honest.
It is complex, absolutely. But I really think it's important that we start dealing with these questions now while the field is still relatively new. We have a real chance to shape the future of psychedelic use and to make sure it's responsible, ethical, and ultimately beneficial, both for individuals and for society as a whole.
Okay, so let's try to bring this all together. We've explored the world of microdosing, from how it works on those tiny serotonin receptors in our brains to these huge potential societal shifts it could bring about. What are the key takeaways you want our listeners to remember?
I think the most important thing is to remember that the science is still evolving. There are some promising hints that microdosing could have some benefits, but we really need more rigorous research before we can say anything for sure about both the positives and the negatives.
Right. So until we have that research, it's really important to be cautious and maybe a little skeptical, right?
Absolutely. It's easy to get excited about the potential, but we need to make sure we're basing our decisions on actual evidence, not just anecdotes. And even if someone does decide to experiment with microdosing, it's crucial to do it responsibly. Talk to a doctor, get informed, and be careful.
Okay. So approach with caution, get professional guidance, and keep up with the research as it comes out. Great advice. Any final thoughts you want to leave our listeners with?
I'd say this. All of this interest in microdosing, even though it presents some challenges, it also represents a huge opportunity. It's driving new research, it's pushing us to understand the brain in new ways, and it could even lead to new treatments for mental health conditions.
It does feel like we're entering a whole new era of psychedelic exploration, doesn't it? It's exciting, but also a little bit scary.
It is. And I think the key to navigating this new territory is to stay curious, to think critically, and to keep an open mind.
Couldn't have said it better myself. Okay, that was a deep dive. Now go explore. Keep researching, keep those critical thinking skills sharp, and we'll see you on the next deep dive.